So one of the most confusing aspects of using the ophthalmoscope is how do I adjust these lenses for my own vision and the patient's vision? It's really not that complicated. So this wheel allows you to adjust diopters of the lenses. The red lenses are typically for nearsighted patients, myopic patients, and the green lenses for presbyopic patients or those who are farsighted. Almost everyone is in the red range, and I tell my students, are you in the red? And they all say yes, because they all have big debts. But that's where most young people are with their myopia. And just experientially, most people's vision gets worse through medical school. Sometimes it gets better after that. But anyway, the way to figure out your lenses and what the setting here is to look through the hole at something on the wall with print on it. And then you can adjust those lenses until the image appears clear, just like you would at the eye doctor. And that's your setting. Now you can ask the patient to do the same. And let's suppose you have a -3 and the patient has a -2. I'm going to ask you, think on your own, what color and number lens would you dial in? Most of my guys have long since forgotten how to add negative numbers, but the point is, you add negative numbers, the number becomes more negative. So -3 plus -2 is -5. So if you're examining a patient with a -2 deficit and you're a -3, you would plug in a red 5 before you begin the exam. Not that you can't adjust it after that, but that's how you determine what the lenses are. And of course, acute things can happen, but one of the major mistakes beginners make is that they click through lenses very quickly. And so you need to click about 1 lens per second to give your own eyes a chance to say, okay, no, that's not as focused as it could be. Okay, next lens, and so on. Please don't click through a bunch of lenses all at once. Very similar on the Welch-Allen model. The numbers show up in the little window below. Typically, you start on the white window, which is 0, and then you can go toward the red, which is usually push upward, or green as you pull downward till you have the image in focus.